Hi, my name is Niccolo Piazza. I'm an interventional cardiologist from Montreal at the McGill Montreal University Health Center. And today with us we have Dr. Kentaro Hayashida from Japan. We have Dr. Chen from China. And we have Dr. Michael Lee from Hong Kong. And we'll be discussing what are some of the specific challenges of introducing TAVI in Asia. So Kentaro, maybe we'll start with you. Yep. Tell us a little bit some of the challenges you face with patient selection.
Okay, so in Japan, there are a lot of patients who are really small body size, like the mean body surface area is 1.4, and sometimes we had the patient with a really small body surface area like 1.2, so the annular size is really small, as well as the aortic valve really calcified. So we should take care of this kind of the really small patient. That is our challenge.
Okay, so small body size, small aortic valve anatomy.
Yes.
Okay, and that of course can lead to potential problems with device size selection and
yes.
ruptures and during the procedure. Yep. Okay, Dr. Chen, what are some of the challenges you're facing in China with respect to patient selection?
Yeah, in China, I think the high prevalence of the bicuspid in TAVI screening patients, about 50% patients are bicuspid. And we know the principle of the TAVI procedure in bicuspid is some different from the tricuspid. So to us, to Chinese doctors, we want to find a new method to how to premise the TAVI procedure successful. Yeah. I think it's Chinese issue.
Yeah, so we also find treating bicuspid patients rather difficult. There's challenges in valve sizing and also implantation techniques. And yourself, Dr. Lee, what do you find as challenges in patient selection from Hong Kong?
It's very similar in Hong Kong as compared to other Asian countries. We have small patients, small anatomy, so we see a lot of small islets. So a lot of peripheral complications can happen if we don't handle it good enough. Mm-hmm. And then we have small annulus, small sinus that would pose complications such as sinus rupture, coronary artery occlusion. We also have low coronary ostia. Mm-hmm. So these are all the challenges that we are facing nowadays.
Okay. And Kentaro, can you tell me a little bit about the calcium volumes you're seeing in your patients?
Okay, so in our Japanese patient, we have a lot of patients with the really calcified aortic valve. And we also have the patient with really small sinus of Valsalva because they have really small sinus of Valsalva. Okay. The calcium amount may lead to the complications.
Okay, so from what we're hearing now is that we have issues with bicuspid valves, heavy calcification, and small patient anatomies. Okay, let's move on to the second part of our discussion. What are some of the reimbursement and access issues you have in, let's say, Hong Kong, Dr. Lee?
Well, it's a little different from the US or European countries. In most parts of Asia, the patients have to pay for the device, for the procedure out of their own pocket. I think except Japan, it is not reimbursable in most parts of the Asian countries.
Okay, and Dr. Chen, is TAVI reimbursed in China?
No, so far because the TAVI, each device cannot approved by the SFDA, the Chinese government. So nowadays we have no reimbursement to this device, just in trial.
So in Hong Kong, no approved devices?
We have approved devices, but
which ones are approved?
The Sapien, both Sapien XT and S3,
okay.
And then the core valve,
okay.
FLUR, and the portico device.
Okay. In China, no devices are approved, no. And in Japan, what devices are approved?
Okay, so we're studying the Sapien 3 from this month, but we haven't studied the Evolute-R yet. We're going to have the Evolute-R from next year, okay. And the Lotus valve is still under the way of the clinical trial phase now.
Okay. And let's touch base on the last concept of education. So what do you see as some of the educational challenges, Dr. Chen, in bringing TAVI to China?
So, in mainland of China, any TAVI procedure just begin, like the doctors So we think it's very important to build up a standard procedure to these doctors. So we sit Chen will just focus on the how to basic learning course and share with the most colleagues to with some experience, successful experience in TAVI procedure.
Right.
It's a help to our Chinese doctors.
Yes, and last year we had our first PCR CIT Chengdu valves.
Chengdu valve. And
Yes.
the second edition will be held in November this year.
Okay. And Kentaro, you did a fellowship in
Yes.
Massey.
Yes.
How helpful was that in order to bring some knowledge back home?
Okay, actually, I spent 3 years in Massy, France. It was really helpful for me to learn a lot from the Western experience because we studied the TAVI procedure from 2009, and we didn't have CT scan at the time, but it improves gradually year by year. And after coming back to Japan, so my experience was really precious. And but now it is really difficult to bring the global standard to Japan, and because Japan is relatively isolated from the rest of the world.
Okay.
So that's the reason why we studied the PCR Tokyo valve to bring the global standard to Japan and Asia and beyond.
Okay, so we have Chengdu PCR valves, we have PCR Tokyo valves. You went away, you did a fellowship, brought knowledge back. Dr. Lee, how are you trying to overcome some of the educational challenges in Hong Kong?
Apart from the regional meetings, the other meeting would be the AP valves in Seoul,
Okay.
to be held in August this year.
Okay,
We also, in Hong Kong, we send fellows to overseas centers. We have been sending fellows to the US, to Canada, Montreal,
yes.
and then we send fellows to Lausanne and Copenhagen. They all go and learn this technique of TAVI and then come back and to serve the community.
Okay. So thank you very much for sharing with us your views. I have to say that I've had some experience in proctoring in China, and if you think that you're learning from us, I have to really say that we're actually learning from you, actually, how to treat these difficult anatomies and really get the optimal patient outcomes. Thank you very much.
Thank you.